We are Team 26, and our product is Recco.
Guys, we all know what a pain med-rec is. But not only that, it leads to multiple medical errors, which is one of the leading causes of death in the US, not to mention the cost of over $1 billion. The causes for this are many, but now we have a solution. Introducing Recco.
So Recco is a model that aggregates patient data about their medications over time and across many different clinical records. And we've used Metroport to help us organize that patient data and structure it in a format that we can train our language model on top of. And we made our language model using LangChain based on OpenAI's GPT 3.5 and added some biomedical knowledge databases to give it more information about different medications and diseases that those medications are used for. And so we will demonstrate using a couple of different sample questions. The first one, we can ask that the model about medications that a patient is taking. And as you can see, we can use pretty conversational language and it will still output a really usable and actionable outcome with the model. The second type of question that we'll use is around medications that might affect a certain disease state. So is Ollie taking anything that would affect hypertension, for example, or blood pressure? And the model will output a response that highlights exactly a certain medication that Ollie is taking that can affect that particular disease state. And then a third type of question that we can ask our model is whether someone has any allergies. And the model will go through the list of allergies that a patient has and identify which ones are drugs and then output that. And so as you can see, the model doesn't need super specific inputs. It can interpret questions from pre-conversational languages. It can map medications to different diseases and vice versa, and can be used for many different use cases just outside of just the 3 different sample questions that we've shown here.
Alrighty. By implementing Recco, this tool is going to save practices, hospitals, and society a tremendous amount of time. And physicians, nurse practitioners, pharmacists, and nurses who are spending a lot of time med-recking patients are going to be able to focus on what they really need to do. Patient morbidity and mortality is going to improve significantly as medical errors will decrease, and huge cost savings will be passed along to not only patients, but also healthcare systems.
Yeah, and we really want to start with one of the systems that's most significantly affected by that. And this is going to be our skilled nursing facilities, where you have a lot of varied level providers, and they're notoriously understaffed. It's a significant pain point that's been articulated a lot of times over in the literature. So we'd really like to partner with this skilled nursing facility to run a pilot project. In particular, we'd like to do that in a rural area where there isn't a lot of specialty pharmacy to play. We'd then like to use that to basically validate the tool and gather metrics about how this can improve workflows, reduce time spent at task, and also improve outcomes by reducing a lot of those adverse drug events that can happen. As this happens, we're hoping and looking to reach a network effect where we can improve our product by collecting data from the people we're working with.
And our future vision is to make this an auto med-rec tool where we can aggregate a patient's entire medication history across clinical claims and pharmacy data and provide clinicians with up-to-date information about a patient's medication history. And over time, transition this to the patient as well to allow patients to see their med list, fix any errors in their med-rec list, and then ask any questions they have about particular medications to their providers and to their pharmacists. And with that, thank you to all of our mentors, sponsors, and organizers of this hackathon.